Hi, my name is Sharon Mallon and I'm a lecturer in mental health at the Open University. And I, along with colleagues at Queen's University Belfast and the University of Ulster, have written a paper that looks at the social dynamics of suicide among women. I have been researching suicide for around 15 years now, and the idea for this paper came about actually when I attended an event in Northern Ireland about male suicide, and I was struck by how we predominantly think of suicide as a male issue, and this is largely due to the fact that, with the exceptions of a few countries, the number of male suicides vastly outweighs the number of female suicides. But I really couldn't remember reading anywhere in the literature anything about female-only suicide, and certainly most of the papers that I'd come across in my career compared male and female suicides, and more recently female suicide had been excluded entirely from the literature as male-only reports became more dominant. So I became quite curious and started to look at the data that we had from the study that we completed in Northern Ireland, and I looked at the GP and coroner's records of 78 women who died by suicide over the 2-year period that we were studying. What was interesting about my initial approach to the data was that, like Simone de Beauvoir, I hesitated greatly about writing a paper about women, partly because I really didn't see, upon looking at the data, what there was that I could say that was new. 85% of the women had attended at some point in their life for the GP for a mental health problem, and many of these people had been suffering from the same conditions when they died. So there was very little that I thought at that point I could say that was new. So when I started to look at the data through a sociological lens and really looking at the social and personal issues that impacted on the women, I did discover that social issues were quite prominent in these women's lives. In fact, 34% of the women had experienced a bereavement that could be identified as a trigger for their emotional distress, while 32% of the women had issues related to motherhood. This included failed fertility and, in other cases, postnatal depression, while 26% of the women had also experienced a sexual assault. This was sometimes in childhood and had long-lasting effects, and in other cases had come about in adulthood. What I also noticed quite interestingly was that if I only looked at the coroner's records, these social issues didn't become apparent at all. The coroner's records relied very heavily on medical diagnoses as an explanation for the women's suicide. So what I really call for in my paper is that we should be looking for more female-only studies of suicide, but that we should be cautious about researching women's death using coroner's records because they're only showing part of the story. But really, to date, I do not think we've taken into account really the social nature of the trauma that may trigger or exacerbate emotional distress among women. And the more we rely on these simplistic medicalized explanations for suicide, we may actually be hampering our ability to further reduce the number of female suicides that occur each year. I hope you will click on the link and that you enjoy reading the full version of our paper. Please feel free to get in touch with me via the email address that will be beside the paper. Thank you. Bye-bye.